I was 13. I was in my first year of high school when my life was suddenly interrupted.
It was unbelievably shocking. It's not something you ever imagine hearing, that your child has brain cancer. Dylan's symptoms were quite mild initially. They began a couple of months before he was diagnosed. He was getting headaches. He also started throwing up and seemed to be a little bit lethargic. I started taking him to the doctor. The first appointment, actually, in fact, the doctor said that maybe he needed a haircut. I kept taking him back twice a week. We were at the doctor. He had blood tests, and initially it was said that he had an infection. So we were sent off with medication and went back the following week, and this continued for about 6 weeks. But honestly, I would never have thought it was a brain tumor, let alone cancer.
They found a large mass here in the back of my head, in my cerebellum. It was the size of a golf ball. When I woke up from surgery, I couldn't do anything. Not even lift my head. I had to learn how to swallow, to talk, to sit, stand, and walk. Everything. I had to learn how to tie my shoelaces and walk upstairs before they would let me come home.
Brain cancer is quite a broad area, and we generally in oncology refer to them as brain tumours. And there's lots of different types, and so they require different treatments because they're very different tumours. And so the treatments that we use are often a combination of things. So surgery is still very important to try and remove as much of whatever tumour it is as possible. There is radiotherapy. That's very important for many brain tumours, and there's chemotherapy as well, which can be very important in many brain tumours we treat in children.
I was fitted with a custom-made mask and strapped down to the radiation table. 5 days a week for 6 weeks. I had finger pricks to check my blood counts and took medication daily. I was connected to an IV pump for the week, pumped with fluids, had blood tests, pain and nausea medications, and of course, the toxic stuff. The stuff that kills cancer. Chemotherapy. I lost weight, my hair fell out, a gang, and I felt terrible. Because chemo kills the good cells as well, I ended up in emergency a lot. My immune system was wiped out, and I needed 28 blood transfusions. During treatment, I was never well enough to go to school.
I became a blood donor after finding out that kids with cancer or cancer patients need a lot of blood.
So the basic treatments have actually been around for a long time. So for example, radiotherapy and surgery have been around for many years. And the surgeons are, with time, are getting more experience and getting better with their surgery. And same with the radiotherapy, in the way that they can target the tumours, they're doing a better job of limiting the toxicity that you can get with the treatment. Chemotherapy actually has also been around for quite a long period of time. And while we're making little minor changes around the edges, the basic chemotherapy for many of our brain tumours hasn't changed a lot actually over the last, say, 10 or 15 years. So we're learning a lot more about the tumours themselves and realising there's lots of different subtypes within tumour groups. But I have to admit our treatments haven't actually changed a lot over that time. With learning more about these tumours, we're starting to learn that maybe we can use more targeted therapy. And it's becoming standard of care for some types of tumours, but for the majority at the moment, we're still using the same old type of treatments: surgery, radiotherapy, and chemotherapy that we've been using for many years now. For many of our patients, our treatments are effective. So you're a perfect example of that. You know, you had a very aggressive type of brain tumour that needed surgery, needed radiation, needed chemotherapy, and now the chance of it coming back is very small. I don't think it will. So that's a good example of a tumour that we do treat well. And so for many of the children we treat, we can get on top of the tumours. They don't always go away completely, but sometimes we don't actually need them to. And unfortunately, that's not the case, obviously, for all patients with all tumours. So unfortunately, there are some tumours that do very badly, no matter what we do. The biggest issue, I suppose, with our treatment, while it can be very effective, is that they do get side effects. So obviously, surgery can lead to significant issues if you have to remove an area of your brain that's important, say, for your hand function, for example. So the surgeons are getting very good now to try and avoid that, but sometimes it's not possible. Radiotherapy as well, very good treatment, but the younger you are, the more problems it causes. So one of the biggest toxicities with radiation, in the short term it can make you feel sick, it can make you feel very sleepy, but it's the longer term side effects that we worry about. And some of it can be your hair doesn't grow back fully, but more importantly is that if you have a big dose of radiotherapy, and it doesn't matter where you get it in your body, that it doesn't sort of grow or learn from that time point nearly as well as if you haven't had it. So your brain obviously is a very important part of your body. You need it to develop, especially if you're young, and learn new things. So it's not nearly as good at doing that. And so that's a toxicity we don't like, but at the moment we don't have anything much better to offer, and it works. Chemotherapy as well can cause lots of acute side effects like your hair falling out, but it grows back as soon as you finish. It can certainly make you feel sick, it gives you a risk of infections, but most of those are short term, and when you finish, it all gets better. You can also have long-term side effects as well. So sometimes it can affect your heart function long-term, your hearing, your kidney function, and even your fertility as well sometimes. So there are a lot of side effects, unfortunately, to our treatments, even if they do work really well for treating the brain tumour. There is one type of brain tumour that often occurs right in the middle, and it's not a place where the surgeon can go in and take out. So surgery is not an option for that particular tumour. Chemotherapy treatments don't seem to work, and we tried lots and lots of them, and the radiotherapy can work, but it's only temporary. So often we get a short-term shrinkage, but then after a few more months, it grows back again. So at the moment there is unfortunately one type of brain tumour that we still do not have any good treatments for. We're working hard, we've got lots of trials trying new treatments, but right now there is a tumour that we can't fix. So we're always trying to do better. One, to fix the kids if we can't, and two, to fix the kids but not cause them any side effects. So we've got lots of work to do in the future to improve things for all children with brain cancer.
I'm 18 now. I'm in my last year of high school. I have just had my 19th MRI, and I'll continue to be monitored for the rest of my life. I've learned some valuable lessons, but I know I'm actually one of the lucky ones.